a lot of medicines have a lot of different properties based on their absorption, based on their protein binding, their half-lives, their interactions with other medications, and different other comorbidities. And so, we're going to review a little bit about how protein binding can affect levels, and when you have a highly protein-bound medication, sometimes a free level rather than a total level is more important. When some of the absorption issues and half-lives, there's a difference between medicines with very short half-lives, and identifying the peaks and troughs are more important than medications with very long half-lives, where it really doesn't matter when you get the level. I'm also going to talk a little bit about comorbidities. So many of these medications are metabolized by the liver, and so as people with liver dysfunction, it's going to affect the way medications are metabolized. If someone has kidney dysfunction and the medicine is renally excreted, it may accumulate and you have to reduce the dose, or if you didn't know that they had renal dysfunction, they started to get toxicity, that would become evident with levels. The other time we like to get levels is for people who are preparing to become pregnant. It is difficult to know what the appropriate level for many of the medicines that we use in pregnancy might be. And so getting a pre-pregnancy baseline, as long as the neurologist prepares with the woman ahead of time, you can get that level of their optimal level for seizure freedom, and then that would be your target throughout the pregnancy, because as they dip, as the metabolism changes throughout the pregnancy, that would change, and you need to adjust the dose to maintain that. So they need to know what their patient are all about. Our goal is always seizure freedom. You have to always balance that with toxicity from the medications. Sometimes people can tolerate huge doses of medicines, and they're still not seizure free, and then you always have to ask the question, are they taking the medicine? And so a level can be very helpful in that situation. In contrast, some people are very sensitive to medications, and they can be on a very small dose, and when you measure their level, it's super high, and then they're obviously compliant with the medicine. The medicines, they're just really sensitive to it, and it's not working for them, and so that would be a medicine that you would want to switch out. And then just always paying attention to the other medications that they might be on, because of the risk of interactions with their medicines. I think the best information is about, a lot of people like to treat some people like to treat drug levels, but it's really all about the patient, and having that conversation with the patient, how to get them seizure free with the least amount of toxicity.